Hi, and welcome to East Meets West, an integrative approach to men's health. I'm Dr. May. I'm a naturopathic physician, board certified in endocrinology, and we're here to talk about all things men's health. Mike, introduce yourself, buddy.
I am Michael Johnson. I've been practicing acupuncture for 15 years now, and I treat a lot of men's health stuff too. So I'm really excited. Dr. May and I worked together for years, and we have some really awesome and unique approaches to integrative health where we both work from our perspectives to help men who are going through a lot of different issues. So I'm excited about today.
Yeah, me too. This is a subject that I'm increasingly seeing more and more of. So I'm excited to kind of dive into it and give you guys some options for treatment. So the topic today is erectile dysfunction. All
Woohoo!
right. Yeah. Yeah. The topic that, most any guy over the age of 40 has some type of stress or issues with and doesn't want to talk about it.
Exactly. I mean, I've seen so many people over the years that by the time I figure out that that's something they want to work on, they've already spent a lot of money and time and haven't even mentioned it because they feel like they can't talk about it. So I'm really
Mm.
excited about having a conversation where people realize this is something you can talk about with doctor you trust or people you trust, and it's not, you're not alone in this. So
Right. Yeah, you're definitely not alone. Let's look at some numbers. So this was a study back in 2012 that estimated then that it was around the prevalence of erectile dysfunction was around 30 million, and that's
wow.
just in the US. So that's a substantial number. Now, if we go by ages, 26% of men younger than 40 have erectile dysfunction or some form of it, 40% of men over the age of 40, and then 70% of men at the age of 70 have
Wow.
erectile dysfunction.
That's a
Now, there was
lot
a
of people.
study, yeah, there was a study done that looked at a lot of different countries. So there are 8 different countries. The US was one of those. And guess who had the highest rate of erectile dysfunction? Yep, you're it. Yeah, it's the US. Yeah. Our overall percentage was 22%. So
Wow.
yeah, yeah. So we have a problem, and it's worse here in the U.S. So we'll talk about maybe some theories on why that is. But I'm curious, Mike. So from a Chinese perspective, tell us a little bit about erectile dysfunction and what it kind of means from that perspective.
So they'll look at it from a couple different perspectives. One is if there's not a lot of external components, which I'll get into about, stress, anxiety, that kind of stuff. If it's just, you don't, there's no known cause, you just have erectile dysfunction, then usually it's a kidney issue, which should surprise no one if you listen to this
Right.
podcast
If I had to
at
guess,
all.
that's what I would have went with.
But it actually makes sense because in Chinese
Mm,
medicine, the kidneys aren't just the kidneys, it's also the reproductive system. So
mm,
part of the kidney is the physical, what the kidneys do. And the other part is just the reproductive system and how it works. So basically, if you're not getting enough energy, which as you age, again, this makes sense with your numbers, but as you age, your kidney function goes down, both reproductively and the kidneys themselves in Chinese medicine. So as you age, it's going to become more prevalent because your kidneys get weaker from our perspective. And as you know, and it's a cycle. It's like your kidneys get weaker, the erections are not the same, and then your kidneys continue to get weaker because you're not using it. Now, there are a couple different theories you'll find interesting. One theory is once you lose your kidney gene, is what they call it, your essence. So
mhm.
once you lose that, some of the ancient texts say you never get it back. Period.
Hmm.
It's gone forever. That's it. But a lot of modern people actually disagree with that. They say, well, there's lifestyle stuff, there's herbs, there's medicines, there's things you can do where you can absolutely get some of that back. And I tend to be in that camp because I've seen people who are very elderly and very depleted who still are able to get back a lot of function. So I would be in the more pragmatic, you're not screwed. There's a way to get
Mhm.
back this function, this energy, this essence. And so that's primary, is like, you have a kidney deficiency and boom, You just
Yeah.
don't have the same erections. You're going to have other symptoms as well when you have that. You're going to have low back pain. You may have some urinary issues. You may have a lot of fatigue, dry skin, that kind of stuff.
Hmm. So what does it mean sort of practically to kind of lose your chi?
So they look at it, it's funny. They look at it not just, if you look at the ancient text, they look at you have a certain amount you're born with. And
Mhm.
then based on how you live your life and choices you make, you actually lose that essence. You lose,
Mm.
and you lose it faster based on high stress, bad diet, bad environment, stuff you're exposed to. You can actually lose that faster. And so, how you live your life makes a huge difference on how you age. And aging is a big part of the whole essence argument.
Mm.
So, basically, when you're younger, if you're taking care of yourself and you're doing all the right things, you're eating right, you're exercising, you're weightlifting, then you're going to lose it a lot less than somebody who's just like, I'm going to drink soda and expose myself to chemicals all day and never exercise, and I'm going to expect everything to work great.
Right. That makes sense. It's kind of, again, we kind of have this conversation each week on the differences here, but we're still kind of saying the same. We're just using different semantics, right?
Yeah.
So the way I explain this to patients is on the I use the word vitality, right? So it's like we kind of all have a sense of how vital we are at this point in time. And one of the ways I sort of measure that is resiliency to stress. So
Hmm.
whatever kind of stress that is, whether it's exercise, good stress, or it's significant emotional stress, or whatever it might be. Like resiliency is the ability to take on stress and still function normally. And so it's like I'm saying the same thing you're saying here. We're just using
Yeah.
different words to describe it.
Yeah, exactly. And it's funny how that happens every week. Primarily, and vitality is actually a good way to look at essence. It's the same idea, it's the same
Mhm.
basic idea. And tied into that are external factors that can affect things. So, stress, anxiety, that kind of stuff are often liver related, which in Chinese medicine, the liver tends to beat up on other organs, including the kidney. It's kind of like the Mike Tyson of the organs that just, when it gets out of control, it just starts knocking other things out.
Yeah, yeah, interesting.
And
Okay.
so anxiety and stress are a big component for this. And not only like, short term. So let's say you have some anxiety and stress that's short term, and all of a sudden you have some erectile issues. And then all of a sudden you have anxiety about the fact that, oh, I've never had this happen before. That's weird. And the
Yeah.
next time you decide that you want to be with your partner, you're like, that comes to mind. You think,
Oh yeah.
oh,
Yeah.
this happened
Yeah.
last time.
Right. Yeah, and we'll get into that sort of psychogenic, cause of ED in just a bit. Before we get too far down the rabbit hole here, let's talk a little bit about like defining erectile dysfunction, because I think that can be there are a lot of guys out there like, I still have function. It's just maybe not as good as it used to be. And so I don't
Yeah.
really have erectile dysfunction, or, what does that even mean? So I'll throw out some symptoms of erectile dysfunction. So think of this as like a spectrum, guys. So it's not like black and white, you have it or you don't have it. It's varying degrees. Okay. So that can include trouble getting an erection, trouble keeping an erection, just reduced sexual desire, so reduced libido, being able to get an erection sometimes, but not every time that you want to have sex, being able to get an erection, but not having it last long enough for sex, and then being unable to get one at any time. So those are kind of the classifications I use currently when I'm talking to my men about like these varying degrees of sort of dysfunction, right? And that's what it is. It's dysfunction. It's not necessarily pathological at this point, although it can be, and it can lead to some pathological issues. But again, think of it as like a spectrum and not a sort of black and white diagnosis.
That's a good way to think about it. And you're right. It's different for every person. I feel like a lot of people I've talked to, they look at it as like if you can get an erection at all at any time, you don't have it. Like it's
Right.
this like, the only people who actually have it are people who are not able to at all, which
Yeah.
is not the case.
Yeah. I see this a lot. I have when in my initial intake when I see guys, I have a questionnaire that talks all about this and asks various questions. Do you have issues getting an erection, maintaining one, blah blah blah. And a lot of times those answers are no. And then I actually ask them again and start prodding a little bit more. I'm like, well, have you noticed any change in the quality? If you notice that sometimes, it's just not how it used to be, or how you want it to be, and almost inevitably the answer is yes. Like, yeah, I have noticed some differences there, or yeah, I wish it could be better. And so those are things we need to know, because the, erectile function is oftentimes a really good gauge for the rest of your health, especially your cardiovascular state. And so having a decent idea of what that looks like gives us a bit of a gauge to determine how healthy you are cardiovascular wise, which is still the number one killer for men.
Yep.
It's cardiovascular disease. So the sooner we can identify that and treat it, the better off you're going to be long term.
Man, that makes sense from our perspective too, because one of the main things the kidney does in our medicine is the kidney and the heart actually work together quite a bit. So
Mm.
if you have kidney dysfunction in Chinese medicine, it's almost always going to at some point relate to the heart,
Hmm.
almost
Hmm.
always. And so it's
Yeah.
interesting that you say that because it's like common.
Yeah. And then there's been some studies on this. The most recent one was in 2018 in a publication called Circulation. And what they did is they followed 1,900 men for 4 years, and they found that those men who had reported some level of erectile dysfunction were twice as likely to experience some type of cardiovascular event, like a heart attack or stroke. And those are just the ones who actually reported ED. So, it's like, yeah, they had twice the risk of those events. So it's pretty substantial.
And that's something that breaks my heart too. Like I feel like it's so frustrating when I see people who are in need and they don't even feel like they're comfortable talking about it because it's such a stigma. And I feel
Right.
like that's something we're doing here with this whole season of our podcast is like I want to eliminate all these stigmas of things you quote unquote aren't allowed to talk about. It's like, you know what, if it's
Mhm.
affecting your health, you should absolutely be able to talk about it with your doctor, with the people you trust in your life. Absolutely.
Absolutely. Doesn't make you less of a man to seek out help, to ask for help, to figure out how to be a healthier man. We don't have to take on the weight of the world and everything else and feel like we have to just take it and not do anything about it. So, good point. All right. Well, let's talk about a few causes. So I'll kind of start with kind of on the Western side here, a few things that I kind of go through when I'm talking with men who seem to have a little bit of ED. So if we can always pinpoint what the root cause is, then it gives us a better chance of actually treating it appropriately. So the
Mhm.
first one is, and the most obvious, and I think the most prevalent, cause is vascular issues. So this is
Mhm.
just problems with blood flow to the penis. Now, this could be due to a lot of different things. It could have to do with atherosclerosis, which is the hardening of the arteries, and that kind of goes back to that published study I just recently talked about. High blood pressure can affect, ED, high cholesterol, diabetes, and obviously like heart disease, like we kind of talked about. But anything that's affecting your vascular system could affect your erectile dysfunction. And oftentimes, like I said, we will first see it there because you have smaller blood vessels there. They're more likely to get occluded first versus larger blood vessels. So if we're seeing signs of occlusion there, it's very likely we're going to see signs of occlusion in other places that have small blood vessels too, like your heart, your kidneys, your eyes. Those are oftentimes some of the first places we'll see like significant, issues with atherosclerosis is in those smaller blood vessel areas. Um, Next is neurological conditions. Now, this is less, but still prevalent. Things like multiple sclerosis, Parkinson's, stroke, spinal cord injuries. Some medications can cause this. Some blood pressure medications can. A lot of antidepressants can.
Oh
Um,
wow.
Yeah, yeah. So if you're on any type of antidepressant and you're having some erectile issues, like talk to your doctor. Like this is something that sometimes could be changed because some have a more profound effect than others. Some of it's dose dependent as well. Um, Two, guys, if you're on an antidepressant and you haven't had your testosterone checked, please do that. I can't tell you how many guys I see who are on antidepressants and they've never had their testosterone checked, and they're depressed because they have low T, not because they have depression. You know that where they need an actual antidepressant. So just kind of throwing that out there.
Yeah, and
Um,
that is so important to have that kind of knowledge of exactly what's going on instead of just throwing something randomly at it and hoping it sticks.
Yeah, absolutely. I see this with low T a lot. I just had a young 30, I think he was 32-year-old guy come in, and he had just been to his I think his primary care, and they measured his testosterone and it was low. And so the guy offered him testosterone. And he was like, I don't think this doesn't feel right. And you're right. It shouldn't be. Like if you're 32 years old and you have low T and you're being offered testosterone as first line therapy, you need to turn and run. That's the worst decision, especially if you're thinking about it, having any kids. That's a terrible idea. And so the first, again, it doesn't tell you once you're on it, you still don't know what the root cause of why you have low T. Like at 32, you shouldn't have low T unless you have some other kind of serious conditions, which again, you need to understand. So don't just jump to testosterone replacement without understanding what the cause is if you can figure that out.
Yeah, and the fact we can actually test for this stuff. Like
Mhm.
this is not something that you have to just guess at. It's like there are
Yeah.
tests for this. There are blood tests you can do to know exactly what's going on. I mean, that's important. And if you root out everything else, let's say you do all the blood tests and everything is great, then that gives you an idea of where you're at. Either way.
Yep. Yeah. Yeah. Exactly. Exactly. All right. Some other medications, ulcer medications, those can sometimes cause some ED as well. There's the psychological factors, like we'd kind of already alluded to: stress, anxiety, depression, lifestyle factors. Smoking really, really has a profound effect. So, guys, if you smoke and you have ED, start there first. I know smoking's a hard thing to quit, but if you want to look at something that affects your vascular system the most, smoking's at the top of the list.
Why is that? Just curious.
Well, just yeah. So it's all about endothelial health. So your endothelium is the inside of your blood vessels, the lining of it. And smoking creates a lot of oxidative stress, which is kind of the same process that happens when metal rusts. It breaks down, right? And so that's through oxidation. That same process happens inside your body. And some things cause a higher level of oxidation than others. Smoking is one of the most oxidative things you can do. So that's why it affects your vascular system, and that's why there's such a huge link between smoking and coronary artery disease, cardiovascular disease in general.
Interesting.
Yeah.
Now, do you
The other
think
thing
that
is,
that could be why America has a higher prevalence? Is like between the medications and the smoking and other things that just makes it more?
oh yeah, it definitely contributes for sure. Plus, just like poor air quality. So it's not just the cigarette smoking, but it's also, are you living close to factories? We both lived in Fairbanks, Alaska for a while. Like in the wintertime, you get sucked in, you get that inversion, phenomenon, and it just sucks in all the exhaust fumes from cars and factories and stuff like that. And you're just breathing that junk in all the time. That can still have the same kind of similar effect as smoking would on your lungs and your vascular system. So yeah, I think it's definitely one of the bigger, contributors to it.
Interesting.
Another one is excessive alcohol use. This one I find is a huge one as well. So guys, especially when we're talking about beer, but any alcohol really, will upregulate an enzyme that's produced by your fat cells. It's called aromatase. Now, what aromatase does, it converts testosterone into estrogen. So the more alcohol you drink, especially beer, then the more of this enzyme you're producing and the more of your testosterone you're going to convert into estrogen. So literally, the more alcohol you drink, the less of a man you become. Literally. So really watch the alcohol intake, and just know there's no safe level of alcohol use. Alcohol you have to think of as like a stress on your system. Now, if you're vital, remember we talked about vitality there in the chi. If you have a lot of vitality and chi, you can take on some stress and still function normally. The problem is if you've got a bunch of other stuff going on, maybe you're pre-diabetic, maybe you have some high blood pressure, maybe you're super stressed, maybe you have some sleep apnea, you're not sleeping well. You've got all these other things that are going on as well. You realize your vitality is not that good. Then alcohol is going to be an even more robust stress on your system, which is just going to knock you down even more and affect you in a greater way. So think about that next time, because we often use alcohol as a coping mechanism for stress, right? So we feel stressed. We're like, man, I'll just have a little alcohol, a couple of beers or something. And that just kind of relaxes me and helps, mitigate some of the effects of that stress. And, occasionally that may be okay, but not a great long-term solution. It's going to have, the opposite effect than what you're looking for.
I agree, and everybody also has a different idea of what high alcohol use is. So I've talked to some people who thought like, oh yeah, I just have 4 shots at bed or something, and that's normal, because to them that is normal. But it's like, well, but when we're talking about what we're talking about right now, health wise, it's like it's going to have serious effects. Or I'll just have a 6-pack of beer a night, and then
Yeah.
I'm fine.
Yeah.